In 2007, the National Patient Safety Foundation formed the Lucian Leap Institute as a think tank charged with providing a strategic vision for improving patient safety. The Institute works to identify new approaches to improving patient safety, calls for the innovation necessary to expedite the work, and encourages key stakeholders to assume significant roles within the advancement of patient safety. Since its inception, the Institute has acted as a convening body for these key stakeholders. Harvard professor Dr. Lucian Leap is a longtime foundation leader who has dedicated his life to the improvement of patient safety.
What we have done from the very beginning is made sure that every roundtable has on it the targets of our effort, the people who will be the ones who will implement the recommendations.
Dr. Gary Kaplan is a National Patient Safety Foundation board member and a long-standing member of the Lucian Leap Institute. In 2015, he became the chairman of this group of multidisciplinary experts and thought leaders. He has been a key contributor to the organization and a strong supporter of its goals. He has acted as co-chair for multiple roundtables hosted by the Institute.
We tap into their expertise and understanding, and so in those ways we work to stay abreast of what's happening in the field of patient safety, and also to continue to foster and stimulate innovative improvements.
Gary and I share a very strong belief that the key to everything we want to do in safety is leadership.
Dr. Tejal Gandhi is the president and CEO of both the National Patient Safety Foundation and the Lucian Leap Institute.
NPSF has always been a big tent, and we bring together patients, families, healthcare providers, vendor organizations, hospitals, healthcare systems, where everybody works together to create and disseminate best practices in patient safety.
In 2009, the founding members of Lucian Leap Institute identified 5 transforming concepts that were essential for the transformation of quality and safety in healthcare organizations. These concepts were presented in an article originally published in Quality and Safety in Healthcare, now BMJ Quality and Safety, and include medical education reform, care integration, consumer and patient engagement, joy and meaning in work, including workforce safety, and transparency.
These 5 concepts are essential to the culture change that needs to happen in medicine, in healthcare, and that we needed to really focus in on these and help people understand them better.
The Lucian Leap Institute set out this plan for having 5 reports in 2009 as the aspirational transforming concepts of how we're going to really advance patient safety. Reforming medical education, care integration, patient engagement, workforce safety, and transparency are as critical now as they were then, but now we understand even better, hopefully, how to actually make progress in those areas.
The executive summaries and associated recommendations of the 5 reports are now being released in a single document, with a focus on dissemination to leadership.
As I think about the compendium that's being released, that really reflects on the work of our 5 roundtables, white papers on the 5 transforming concepts, each of the white papers that will be featured in the compendium have specific recommendations. And so I think we need to take those recommendations seriously.
I would think that leaders would take away from this report the need for them as leaders to take responsibility for and make sure it happens, that care is coordinated, and that patients have a seamless experience from the first time they come to see the doctor all the way through all of their care. You can't give safe care if the care is chaotic.
Patient safety is a public health issue, and the National Patient Safety Foundation's Lucian Leap Institute is setting a strategic direction on how to advance our progress and create a world where patients and those who care for them are free from harm.